Every single morning, millions of Americans over 60 wake up, walk to their medicine cabinet, and swallow their pills. They think they are doing everything right, but here's the truth that nobody is telling them. Some of those pills, they are doing almost nothing for your heart. And the ones that could save your life, many people are not even taking them. My name is Dr. Victor Hale. I am a cardiologist, and I have spent the last 32 years of my life studying one thing, the human heart. I have sat across from thousands of patients. I have held hands in hospital rooms. I have delivered news that no family should ever have to hear. And I can tell you this with complete confidence. Most heart attacks after 60 are preventable. Not 10% preventable, not 20% preventable. Studies show that with the right medicines, the right habits, and the right information, up to 80% of heart attacks could be avoided. So today I am going to give you that information. I am going to walk you through 5 medicines, real, proven, doctor-prescribed medicines that have the strongest scientific evidence for eliminating heart attack risk after age 60. I will tell you exactly what each medicine does, how it works inside your body, who needs it, and what the numbers say. Stay until medicine number 5, because that is the one most people never hear about. And for many of you watching right now, it could be the most important. Let us get started. Before I tell you about these 5 medicines, I need you to understand something. I need you to understand why the heart becomes so vulnerable after 60, because once you understand this, everything else will make perfect sense. Think of your heart like a high-performance engine. When you are young, in your 20s, your 30s, that engine runs beautifully, strong, smooth, efficient. But after 6 decades of nonstop work, beating 100,000 times every single day, pumping 2,000 gallons of blood every 24 hours, things start to change. Here is what happens inside your body after 60. Number 1, your arteries get stiff. The walls of your blood vessels, which used to be flexible like a rubber tube, begin to harden. This is called arteriosclerosis. And stiff arteries mean your heart has to work much harder to push blood through them. Number 2, cholesterol plaques become dangerous. For decades, LDL cholesterol, the bad kind, has been quietly sticking to your artery walls. By age 60, many people have significant plaque buildup. And here is the scary part. It is not the plaque itself that causes a heart attack. It is when a plaque suddenly ruptures. When it breaks open, your body sends a blood clot to seal it. That clot blocks the artery. Blood stops flowing to the heart muscle. That is a heart attack. Number 3, blood pressure climbs. As arteries stiffen, blood pressure naturally rises. High blood pressure is like running your garden hose on full blast, 24 hours a day. Eventually, something gives way. Number 4, your blood clots more easily. As we age, blood becomes slightly thicker and more prone to forming clots, and a clot in a coronary artery is one of the leading causes of sudden heart attack, even in people who felt perfectly fine the day before. Number 5, the heart muscle itself changes. It thickens slightly. It becomes less efficient. It is more vulnerable to irregular rhythms, especially a condition called atrial fibrillation, which I will talk about shortly. Now, here is the good news. Every single one of these 5 problems, every single one, can be directly targeted by the 5 medicines I am about to reveal. So let us go through them one by one. Medicine number 1 is called a statin. You have probably heard this word before, but I promise you, most people do not truly understand what statins do. And once you understand it, you will never look at this little pill the same way again. Common statin medicines include atorvastatin, brand name Lipitor, rosuvastatin, brand name Crestor, simvastatin, brand name Zocor. So how do statins work? Inside your liver, there is a chemical process happening right now that produces LDL cholesterol. LDL is not inherently evil. Your body needs some cholesterol, but when you have too much LDL, it starts sticking to your artery walls, layer by layer, year by year, building up into those dangerous plaques I mentioned earlier. Statins work by blocking a specific enzyme in the liver called HMG-CoA reductase. This is the exact enzyme responsible for producing LDL cholesterol. Block the enzyme. Less LDL produced, less LDL in the blood, less plaque building up, fewer plaques rupturing, fewer heart attacks. Simple, powerful, proven. But here is what makes statins truly remarkable. They do not just lower cholesterol. Studies show they also reduce inflammation inside artery walls, stabilize existing plaques so they are less likely to rupture, slightly improve the function of the artery lining itself. The numbers. The famous Jupiter trial, one of the largest heart studies ever conducted, showed that statins reduced the risk of major heart attack by 44% in adults with elevated inflammation markers. The heart protection study, which followed over 20,000 patients, showed statins reduced heart attacks by 25–35%, even in people whose cholesterol was not dramatically high. Translation: if 100 people over 60 with high cholesterol take statins consistently for 5 years, approximately 35 to 44 of them will avoid a heart attack they would otherwise have had. Who should take statins? Statins are typically recommended for adults over 60 who have high LDL cholesterol above 130 mg/dl, a history of heart disease or previous heart attack, diabetes, a 10-year cardiovascular risk score above 7.5%, which your doctor can calculate for you. Typical doses: atorvastatin 10–80 mg daily, rosuvastatin 5–40 mg daily, usually taken at night because the liver produces more cholesterol while you sleep. One important warning: some people experience muscle aches with statins. Always tell your doctor if this happens. And please, never stop statins suddenly without medical advice. Stopping abruptly can actually increase your heart attack risk temporarily. Medicine number 2 is probably sitting in your medicine cabinet right now. Low-dose aspirin, baby aspirin, 81 milligrams per day. It looks harmless. It costs almost nothing, but this tiny white tablet has saved millions of American lives. Here is why. How does aspirin protect the heart? Remember when I told you that most heart attacks are caused by a blood clot forming on top of a ruptured cholesterol plaque? Aspirin directly attacks that process. Inside your blood, there are tiny cells called platelets. Their job is to clump together and form clots whenever there is a cut or a break, like a repair crew that rushes to a wound. But sometimes those platelets get triggered in the wrong place, inside a coronary artery, on top of a ruptured plaque, and the clot they form blocks blood flow to the heart. Aspirin blocks a chemical called thromboxane A2, which is the signal platelets use to clump together. Block that signal and your platelets become less sticky. Less sticky platelets mean fewer dangerous clots. Fewer dangerous clots mean fewer heart attacks. The evidence: for people who have already had a heart attack, aspirin reduces the risk of a second heart attack by 20–25%. This is called secondary prevention, and aspirin is a cornerstone of it. Now, a very important update for 2024. The guidelines on aspirin have changed in recent years. The U.S. Preventive Services Task Force now says, for adults ages 40–59 with high cardiovascular risk, aspirin may be beneficial. For adults ages 60–69 with previous heart attack or very high risk, aspirin is still strongly recommended. For adults over 70, the benefit versus bleeding risk must be carefully evaluated by your doctor. Bottom line: do not start or stop aspirin therapy on your own. This decision must be made with your doctor based on your personal risk. But if you have already had a heart attack and your doctor has prescribed aspirin, take it every single day without fail. Typical dose: 81 milliliters once daily, taken with food to protect your stomach. Medicine number 3 is actually a family of 2 related medicines: ACE inhibitors and ARBs. Common ACE inhibitors: ramipril, brand name Altace lisinopril, brand name Prinivil, enalapril, brand name Vasotec. Common ARBs: losartan, brand name Cozar valsartan, brand name Diovan olmesartan, brand name Benicar. These medicines do something remarkable. They do not just lower your blood pressure, they actually protect, repair, and remodel your heart muscle itself. How do they work? Inside your body, there is a hormone system called the renin-angiotensin system. Think of it like a volume dial for your blood vessels. When this system is overactive, your blood vessels tighten, your blood pressure rises, and your heart is forced to work harder. ACE inhibitors block the enzyme that activates this system. The result: blood vessels relax, pressure drops, and your heart gets a break. ARBs work slightly differently. They block the receptor that angiotensin binds to. Same result: relaxed vessels, lower pressure, protected heart. But here is what makes these medicines extraordinary. Beyond blood pressure, studies show ACE inhibitors and ARBs reduce inflammation inside arteries, prevent the heart muscle from thickening and enlarging, a process called cardiac remodeling, protect the kidneys, which are closely connected to heart health, reduce the risk of heart failure. The numbers: The landmark HOPE trial, Heart Outcomes Prevention Evaluation, followed over 9,000 high-risk patients. It showed that ramipril reduced the combined risk of heart attack, stroke, and cardiovascular death by 22%, even in patients whose blood pressure was not severely elevated. For every 1,000 high-risk patients over 60 who take ACE inhibitors or ARBs for 5 years, approximately 150 heart attacks and strokes are prevented. Who needs these medicines? Adults over 60 with high blood pressure above 130/80 mmHg, previous heart attack or heart failure, diabetes with kidney involvement, chronic kidney disease. One common side effect of ACE inhibitors, a dry, persistent cough. If you develop this, tell your doctor. They will simply switch you to an ARB, which does not cause this side effect. Critical warning: never take an ACE inhibitor and an ARB at the same time. This combination is dangerous and must be avoided. Medicine number 4 is called a beta blocker. Common ones include metoprolol, brand name Lopressor or Toprol XL, bisoprolol, brand name Zabeta carvedilol, brand name Coreg atenolol, brand name Tenormin. If statins protect your arteries and ACE inhibitors protect your blood pressure, then beta blockers protect your heart's rhythm, rate, and workload. And after a heart attack, they become absolutely critical. How do they work? Your heart has special receptors on its surface called beta-1 receptors. Adrenaline, the stress hormone, binds to these receptors and tells your heart to beat faster and harder. This is useful when you are in real danger. But when it happens chronically, due to stress, high blood pressure, or heart disease, it wears your heart out. It increases oxygen demand. It makes dangerous, irregular rhythms more likely. Beta blockers sit on those receptors like a protective shield. They block adrenaline from binding. The result: heart rate slows down, heart beats with less force, heart uses less oxygen, blood pressure drops gently, risk of dangerous arrhythmias falls dramatically. The life-saving evidence: for patients who have had a heart attack, beta blockers reduce the risk of dying from a second heart attack by 23% and reduce the risk of sudden cardiac death by up to 30%. They are also extremely important for people with atrial fibrillation, an irregular heartbeat that is increasingly common after 60 and which dramatically raises heart attack and stroke risk. Beta blockers keep the heart rate controlled and reduce the risk of dangerous rhythm problems. If you have had a heart attack and your doctor has not prescribed a beta blocker, please bring this up at your very next appointment. Critical warning: never stop beta blockers suddenly. This is one of the most dangerous mistakes a patient can make. Stopping abruptly can trigger a rebound effect, causing your heart rate to spike, your blood pressure to surge, and significantly raising your risk of a heart attack or dangerous arrhythmia. Always taper off under your doctor's supervision. And now, medicine number 5, the one I promised you at the beginning. The one that most doctors do not bring up unless your specific condition demands it. But when it is needed, it is absolutely life-saving. And millions of Americans over 60 need it right now and do not even know it. It is called an anticoagulant, a blood thinner. The modern ones you will hear about: apixaban, brand name Eliquis rivaroxaban, brand name Xarelto dabigatran, brand name Pradaxa. The older one many of you may already know, warfarin, brand name Coumadin. Who needs this medicine? This medicine is specifically for people with a condition called atrial fibrillation, or AFib. And here is the shocking statistic: AFib affects approximately 9% of all Americans over the age of 65. That is roughly 1 in every 11 people watching this video right now. And many of them have absolutely no idea they have it. They feel slightly more tired than usual, occasionally a little breathless. Sometimes they notice their heart fluttering or feeling off, and they think that is just aging. It is not just aging. Here is what AFib does to your heart attack risk. When your heart beats irregularly, blood can pool inside a small chamber of the heart called the left atrial appendage. Pooled blood forms clots. Those clots can travel through your bloodstream to your brain, causing a massive stroke, or to your coronary arteries, causing a heart attack. AFib increases stroke risk by 5 times. AFib increases heart attack risk by 2 to 3 times, but anticoagulants prevent those clots from ever forming in the first place. The numbers. The landmark Aristotle trial showed that apixaban reduced the risk of stroke and dangerous blood clots by 21% compared to warfarin, with significantly less bleeding risk. For AFib patients over 60 who take anticoagulants consistently, stroke risk falls by 60–70%, heart attack risk falls by 20–30%. These are not small numbers. These are thousands of American lives saved every single year. What you need to do right now, if you are over 60 and you experience any of these symptoms, palpitations or fluttering in your chest, unexplained fatigue, shortness of breath without exertion, dizziness or lightheadedness, ask your doctor for an ECG, an electrocardiogram. It is a simple, painless 5-minute test, and it can detect AFib immediately. Detecting AFib early and starting anticoagulation therapy can prevent a devastating, life-altering stroke or heart attack. Important warning, anticoagulants are not for everyone. They increase bleeding risk and require careful monitoring. Your doctor will use a scoring system called the CHA2DS2 VASC score to weigh your stroke risk against your bleeding risk before prescribing. Let me bring this all together for you. 5 medicines. 5 ways science is fighting back against the #1 killer in America. Medicine number 1, statins, atorvastatin, rosuvastatin, destroy the cholesterol plaques that cause heart attacks, reduce heart attack risk by up to 44%. Medicine number 2, low-dose aspirin, 80 stop dangerous blood clots from forming inside your coronary arteries, essential for anyone who has already had a heart attack. Medicine number 3, ACE inhibitors, ARBs, ramipril, losartan, shield your heart from high blood pressure and repair damage to the heart muscle itself. Reduce cardiovascular events by 22%. Medicine number 4, beta blockers, metoprolol, bisoprolol, guard your heart rate, stabilize your rhythm, and after a heart attack, reduce the risk of dying by 23%. Medicine number 5, anticoagulants, apixaban, rivaroxaban. For AFib patients, the medicine that reduces stroke and heart attack risk by up to 70%. If you have AFib and you're not on a blood thinner, please talk to your doctor today. Now, I want to be very clear about something. I am not telling you to go home and start taking all 5 of these medicines on your own. That would be dangerous. Every single one of these medicines requires a proper evaluation, a proper prescription, and proper monitoring by your doctor. What I am telling you is this: go to your next doctor's appointment armed with knowledge. Ask the right questions. Ask about your LDL. Ask about your blood pressure. Ask for an ECG to check for AFib. Ask whether any of these medicines are right for you, because your doctor wants to help you, but they need you to be an active partner in that conversation. You watch this entire video because you care about your heart or you care about someone else's. That already makes you one of the smart ones. If this video helped you, please hit that like button right now. It helps more people over 60 find this information when they need it most. Subscribe to this channel, and because every week I bring you real evidence-based heart health information that your doctor wishes they had more time to explain. And drop a comment below. Tell me, which of these 5 medicines surprised you the most? I read every single comment. I am Dr. Victor Hale. Take care of your heart, because it has been taking care of you every single second for your entire life. I will see you in the next one.